Good morning, everyone. How was your weekend? Did you have a productive weekend? And how is your lockdown going? I hope you're staying strong. Um, Welcome to day 43 of the Vine Health COVID-19 updates. We keep going and we keep staying strong, no matter how tough it is. So, welcome to day 43. The updates are meant to bring you facts and not fiction, to make sure that everything you hear from here is verified, is double checked, and if we make a mistake, we always correct it. So this is to make sure that you have fact and not fiction on here. Good morning. Thank you for sharing my video. I really appreciate that. So yes, so you can get fact and not fiction, and just get real verified, truth on here. You won't get gossip. Well, you get a bit of gossip, but you won't get lies. So today I'm going to talk about a question somebody asked me last week, which was, what's the link between vitamin D and COVID-19? So does vitamin D help prevent or cure or make COVID-19 better? So we'll be talking about that towards the end as usual. But first, I'll give you some facts from over the weekend. A lot has happened, and I'm sure many of you have already seen it on the news, but I'm just going to summarize a few things in different countries. So we'll start with the UK. Today, the UK, the Prime Minister is back to work this morning, which is good, and has given a talk and told us to all be patient, and we have to stay indoors and continue the lockdown. I mean, the lockdown will be eased soon, to be honest, as we'll follow the track of other countries. So he's come back, so we're glad he's well. That's very lucky for him. Also, the number of deaths up until yesterday was 413. Again, I'm not going to try and get my hopes up, because last week I did and then it went up again. But 413, which is every single one of those is painful, is a soul, is a person with families and friends. So we can't just call it out as numbers. And my heart goes out to everyone who's lost somebody during this time, including myself, who've lost people during this time. And to say we stay strong, but it brings the total in the United Kingdom number of deaths to 20,732. So we've crossed the 20,000 mark on Saturday. Tests are now available for all key workers. All frontline workers can request tests. They opened the booking for the test on Friday, I think, and it crashed. But it's available. If you have symptoms, you can get tested. So please, please, please go and get tested. If you're a frontline key worker, get your test done. Look at the website, make a phone call. You can get tested now. At my practice, anyone can get tested with symptoms. I had someone that needed a test. She got it done within a day. We had results back the following day. She was negative. She could come back to work, and it makes a difference, and it's quite reassuring. So please go out and get tested if you're a frontline worker, or if you have symptoms. They're also going to be getting mobile trucks around to make sure that they hit the 100,000 testing mark by the end of this week. So there's no reason for you to suffer in silence. You must go out. And in the UK as well, people are not going to their doctors. You need to speak to your doctors every day, and particularly now we want to get into research as to why Black people are not really engaging with telehealth. So we have the video and telephone consultations, and it's working really well, but we're finding that anecdotally, that means there's no full evidence yet, that the ethnic minority patients are not really getting involved with the video consultations and all of that. So the research is will start into that. So please use it. It works really, really well. If you're ill, do not stay home and suffer in silence. People are dying from things like heart attacks and diabetic ketoacidosis because they are not seeking help in time. So you must do that. In the UK as well, the vaccines, there's a race for the vaccines. The testing has started. We might have something by September. It may not be until next year, but we're hoping that it will be September, so that we can all go back to a semblance of normal life. People are getting really fed up at the moment, and people's mental health is beginning to get really affected. People are not sleeping properly. Their whole sleep pattern is out of sync. They are sleeping during the day, awake at night, and it will affect not just your mental health. It will also affect your physical health if you change your sleep pattern that widely. So I think that's about it from the UK in summary. The US again, drama, drama, drama constantly. The number of deaths in the US is over 55,000 now. It's proportionate to their population because they have a large population, but they have the largest death toll across the world. They think now that hackers are trying to target their research. So I mean, they're pointing at the China and Russia and saying that they are trying to target their higher institutions to prevent them getting the research, because you know that the person that comes up with that vaccine is going to wield a lot of power globally. So it's interesting that in life, it's not just about people's health, power, politics, all of that plays a huge role in the whole thing. The disinfectant gate saga still ongoing, but again, Trump said he was joking. I mean, he was being sarcastic. He didn't mean it. So we'll leave it at that. But I think what he was also trying to say about sunlight, which is linked to the issue of vitamin D that I will talk about later. There is research about sunlight and vitamin D attenuating the effect of COVID-19, but he just didn't, it was very early research, and maybe what he should have done was really understood what he was trying to say before saying it. And also, obviously, if you wipe surfaces with disinfectant, you get to kill the virus quicker. We've all known this. That's why we always say when you get into your office or you get in, you wipe your handles and you wipe that with disinfectant, because we know that will kill the virus. It doesn't mean you should drink it or inject it into your body. That's, I think it came out wrong. And rather than him saying that it came out wrong, he just said he was being sarcastic, and it doesn't look quite right. It's a bit embarrassing. It's like looking at your dad or your grandfather, saying something and you don't want to call them out, and it's a bit embarrassing. You just hold your hands up sometimes and say, I didn't mean it that way. So also for Nigeria, it's a very weird situation in Nigeria. What is going on? Somebody in Nigeria tell me what's going on in Kano. Is it true? The number of people that have died, in such a short space of time, they said over 600 deaths. And all these very important people, everybody is important. No one is more important than anyone. But I mean all these prominent people dying, and people are not sure whether it's coronavirus or whether it's Lassa fever or something else killing them. They're not getting tested. NCDC is not very active in Kano. People are terrified. What is going on in Nigeria? Please, we need to know. Because the number of cases declared is 1,273 cases, and 239 have been discharged with 40 deaths. However, I also know that the NCDC people put out a thing looking for testing kits as well. So there's just something not quite right. People are hungry. They're still hungry. There is really no social distancing in the packed areas. Let's just be honest with ourselves. There's no social distancing. So if this takes hold, it's not going to be good. So, but I know that, the higher power is watching over that country. And, as they say in Yoruba proverbs, says the cow that does not have a tail, it's God that becomes its tail and helps it to chase away the flies. Because honestly, if it takes hold in Nigeria, it's just going to be, it will be horrible. But whatever is happening in Kano, please, we need some facts, but it's really, really not clear. I think the governor has come out and said, I made a statement, but we don't know whether it's COVID-19 because I don't think tests are being done. And I think I heard that, don't quote me, but what I heard is that the NCDC number there is not being picked up and maybe the office is closed. So yeah, that's the update from Nigeria. Some good news, however, is that countries like Spain and Italy, who were where the pandemic just was horrible, and the death rate is about, I think they're about 26,000, over 26,000 in Italy and over 23,000 in Spain. That's coming down. And actually in Spain, yesterday, only 260 people died, God rest their souls. But compared to what they were declaring before, it's much less. And in Spain, similar as well. So about 331 up until yesterday. So they're all beginning to ease their lockdowns. And I know that Italy, from the 4th of May, they're going to sort of ease it a little bit in phases. People have to wear masks, can go out. Children in Spain are now allowed to go outside. So it's all getting eased in countries, and that's going to happen in the UK as well for those of us here. And we all have to start thinking about life after the pandemic. It will take a while for us to all go back to work. Many people will still keep working from home, enjoy it while it lasts, but it won't last forever, And in Africa, there's been some surges in some countries like Cameroon, Somalia, Senegal. People are doing their best, but across the whole continent of Africa, only just under 32,000 cases have been reported. Underreporting or fact, I don't know. Is it the sunlight? Because there is some evidence about sunlight and vitamin D and the effect on coronavirus. There is. So even though I know that in some countries that are hot, they still had the epidemic there, but there is some evidence that I've read. I've actually read one paper. So one paper does not, for those of you involved in research, one paper doesn't give you everything. But this is one paper that I could digest over the weekend, and it's just been published in this April. And it's a paper that was done in Italy where the epidemic was massive. So there is some evidence about sunlight and vitamin D. So I'll come to that just now. New Zealand, again, they're doing really well. Female president, they're doing great. COVID is very well under control in that country as well. So that's all my updates. Now, quickly before I talk about vitamin D and sunlight and COVID, can I talk quickly about some new things that we've been seeing in healthcare in the UK concerning children? So for those who are parents or people who get, just in case you talk to somebody, you never know who you get to talk to. Children are being found to be exhibiting COVID in very different ways to adults. So we're having children presenting with abdominal symptoms, things like abdominal pain, and general GI symptoms, diarrhea, just problems, pain in their stomach. And it turns out that they're having toxic shock and getting really, really ill with sepsis and are COVID positive. So if you know anyone, keep an eye on your children. If anybody says they're having severe abdominal pain, any children at all, please call your GP immediately, who will also immediately refer this child to the hospital so that we don't miss this very, very unclear symptoms of COVID-19. It seems to affect different people differently and different age groups differently. And this is the effect we're seeing that in children, they are getting toxic shock syndrome, starting with abdominal pain and abdominal symptoms and maybe diarrhea, just really not being well. So please, please, please share this video, share the word, just spread it around to the community and to everyone you know that if any child is suffering from abdominal pain, to immediately contact their GP by telephone, who will be able to speak to them about what the next steps are. So this research about vitamin D, and again, conflict of interest here because Vine Health produces vitamin D and we sell vitamin D and we've seen people buying more. So please order your vitamin D. It is important. Even before COVID, I've always said, if anybody that knows me, I always tell you there are two vitamins you should be taking, vitamin D and vitamin B. Then you can add every other thing to it, but vitamin B is important, B complex, and so is vitamin D. But the research is that, and this was done in Italy, and it just showed that people that were vitamin D deficient had more severe disease. But if you supplement with vitamin D, then the effect of the sepsis or the infection is less. In fact, to a point where the paper mentioned about prevention, that vitamin D, if your levels of vitamin D are normal, it's almost preventive against acute respiratory infection of any form. And definitely will reduce the severity of acute respiratory distress syndrome, which is what you find in SARS-CoV-2, which is COVID-19, what you call COVID-19. So that's there. So it says going outside, going into the sunlight, being able to produce vitamin D normally and increase that will also help with the disease. The problem is with dark skin, most of us are deficient. Almost the whole population of Black people have suboptimal levels of vitamin D. So we all need to be supplementing. And they're finding that if you're taking 2,000 units daily, it's safe. As I always say to you, what I do, I kind of, I just see how I am generally, but I tend to go with either 5,000 units a week or 3,000 units twice a week, just to make sure that I'm somewhere, I'm in a normal range. But if you're taking 2,000 units daily, it's safe. At 2,000 units daily for 7 days is 14,000 units a week. So you actually can go that high. So I'll say to you that if you are dark-skinned, particularly if you're dark-skinned, Caucasians too suffer from vitamin D very commonly. If you're dark-skinned, please make sure that your cupboard, when you open your cupboard, there's vitamin D there, and you're taking it, and you're giving your children as well. There are many times in my career, which I've been practicing for a long time now, that you've investigated a patient, investigated, and you just don't know what it is. And then you finally are able to get vitamin D testing, because we don't automatically, they don't allow us to request it without very, very good evidence. You finally get vitamin D test and you find out that this person has almost nothing. And that's why they're ill. And the minute you supplement them, they're fine. So I tell all my patients, please go to the chemist next door, buy your, vitamin D. It's very, very available, and just start taking it. Obviously, I won't sell my vitamin D to my patients at work, because that's not particularly allowed. That's not ethical. So I sell my vitamin D outside work. So that's the evidence. So it's protective against acute respiratory infections, especially if you're vitamin D deficient. And it's even more important now that we're in lockdown, because we are going out less. You don't even understand even the significance of getting in your car and driving, because you get the sun coming into the sides of your car. It might help you boost your vitamin D a little bit. But now that we're indoors all the time, it's even more significant now that you take your vitamin D supplements. It's immunomodulatory, improves your immune system. It makes your chronic disease less severe. It's been seen. It's almost like a wonder vitamin. I can't understand why one single supplement can have such a wide effect on such a wide number of systems in the body. You have hay fever and it's really severe. Add on vitamin D to your treatment. There's so much that it does. So that's that. So thank you to the person who sent the question. It was last week. He actually made me read it, because I'd been kind of ignoring it, and it actually made me just do a bit of research and to see that vitamin D is really crucial. So that's everything for today. Please keep sending your questions, and generally I'll tend to tackle them during the week, do some background research if I don't know the answer to it, and then bring you some facts, not fake news, because I'm still getting all sorts of WhatsApp messages about all sorts of things. And so just be careful the news you ingest, be careful how much time you spend watching the news, spend time with your mental wellness, spend time with improving yourself, and just helping other people around you. Call somebody. I've been hearing about domestic violence increasing. I'm really worried. I tend not to want to tackle issues like domestic violence lightly, because it's something that is very complex. I normally used to give talks about domestic violence, but I still do, but it's very complex, such a complex topic that it takes a lot of sensitivity to deal with an issue like domestic violence. So I will come to it. But if you are watching now and you're suffering from any mental health issues like depression getting worse, or anxiety getting worse, or you're hearing voices or any of that, please send me a message. Send me any questions and things you want to hear. And I can also post links for what you need as well. And also, if you think that you have been abused emotionally, physically, sexually, in any way, please also send a message, send a question as well, because it's so difficult and intricate. But we'll come to it at some point, but I just don't feel ready yet. But if I get some messages, I probably will. So thank you very much for everyone who's watched for the last 43 days. We don't do Sundays. Sundays is for our spiritual reflection. Thank you for everybody who's shared the old people that started with me from day one. Thank you so much. For people who have joined and supported, thank you. Please share the video, like, post, call somebody, check on someone and say, hey, how are you today? How can I be of help? And let's just support and be strong for each other. All right, guys, take care. Have a blessed Monday, and I'll see you tomorrow.